Every doctor I see tells me there's nothing wrong.
And that proves what exactly? That they're wrong or that you're wrong? Come on, you expect me to believe? Get the paddle, she's gonna crash.
Eye issue, brain issue, now a heart issue. You were just upset because the whole time she was with you, she was thinking of my huge, throbbing diagnostic skills.
Very excited to be reacting to House MD Season 5, Episode 5, Lucky 13. On this channel, we are reacting to all 177 House videos, and this will be episode 100. We made it. Let's see if I can get the diagnosis before House does as a doctor working in London.
Stupid baby when you're sane.
Wow.
Yeah. Hey, what are you...
Does your friend have a history of epilepsy? What's her name?
I don't know.
House. We have a case I think you might be interested in.
It can wait. Oh my goodness! I played a practical joke on my best friend. He's badly injured. I was waiting by my window for an hour. Why are you late?
I had a breakfast meeting at Mickey's Diner with the Mercy people.
It's my way of saying welcome back.
Seizure could be the result of dehydration or something neurological.
Or the ecstasy you found in her system. Oh, yeah. Penthouse Forum meets medical mystery. Maybe there is a god. Empty, transient sex.
Were you doing drugs?
Not diagnostically relevant. She's visited 4 other doctors in the past year. None of them found anything. She's a hypochondriac who drank too much.
Blood clots could explain everything.
13. Go stick a needle in your girlfriend's pelvis.
13 said in a previous episode that she bats for both teams, but she never said that one team is no names allowed, one appearance only, and has a strict entry requirement of chemical happiness. Ecstasy may feel good in the short term, but the flood of serotonin and dopamine that's released quickly depletes the body's happy hormones, which leads to the dreaded come down. What does that feel like? Everyone experiences them differently, but for a few hours to a few days, people can experience similar symptoms to depression. Tiredness, lack of pleasure from usual activities, stress, difficulty sleeping, and a craving to take the recreational drug again to try and avoid those nasty side effects. Of course, doing so would delay the inevitable and can start compounding organ damage to places like your heart, kidneys, or brain. How can that happen? Well, ecstasy releases a chemical messenger called antidiuretic hormone that causes the kidneys to reabsorb more water from filtered blood, leading to more being retained. It also makes you thirsty, so not only are you reabsorbing more, but drinking extra too, which can dilute the blood and drop our sodium levels. That is quite important, as sodium dropping low can cause a forbidden cascade of events that leads to your brain leaving your skull. Believe it or not, our brain tends to work better when it's inside our heads, so that isn't good news. This mechanism could also be what caused her seizure, but she was also drinking alcohol and apparently dehydrated, which is unlikely as patients on ecstasy tend to carry enough water with them to put down a deposit for a lake. So let's get more clues.
I like to watch. You ignore me. You know, if you're in the mood to start kissing or groping or showering.
You'll have to excuse Dr. House. He mistakes immaturity for edginess.
Whatever you think we did, we did. And then some.
Lights on or off?
On. She's pretty direct about what she wants.
Score the score. Scale of 1 to 10.
Don't answer.
7.
He lied to me. I need to know why. Find out where he was.
You recognize House's name, and you're the first patient I've seen who actually enjoyed being accosted by him. That you slept with me to get to House?
You might have figured out my motives faster if you'd bothered to ask my name. I wanted to talk to you. I didn't expect you to be so aggressive. Every doctor I see tells me there's nothing wrong.
And that proves what exactly? That they're wrong or that you're wrong? Come on, you expect me to believe? Get the paddle, she's gonna crash.
Eye issue, brain issue, now a heart issue. You were just upset because the whole time she was with you, she was thinking of my huge, throbbing diagnostic skills. Patient's dad had bypass surgery. I mean, she's a candidate for atherosclerosis. She needs an ultrasound. You're a disgrace to your stereotype.
Nice. Steal from your employees.
I always imagined she'd have a sex swing in the living room. 13 had a purse. That's got to be the patient's. Check it for drugs. I call it shotgun in the bedroom.
Purse is clean.
You think an asthma inhaler could be used as a sex toy? Brown recluse. Found it at your apartment. Their venom can cause seizures, heart problems.
That's the second time House has pulled out his knowledge of spiders to try and diagnose a patient. At some point, I wonder if he's just planting these spiders to flex his arachnology muscle. Web of lies. Or we finally unveiled House's secret specialty, the spin doctor. Things have definitely passed the climax for 13 though, as House has now invaded her private life more than a Facebook databank. We do have a new symptom now though. The patient had a cardiac arrest and it needed some therapy by Dr. Jules to allow this forage into 13 lands to continue. Now we know the patient had a clot in one of the veins of her eye, a seizure, and now the heart issues, so what could it be? Spider bite is unsurprisingly pretty low on the likely list, but I have another theory. Foreman mentioned the patient's platelets were high, which could mean many things, but maybe she's predisposed to clotting, or her symptoms could be due to clots and a hidden cancer could be the cause. Where could it be? Well, bowel cancer could lead to blood in the stool or a change in bowel habit, ovarian could lead to bloating, and breast would have a lump or a change in shape of the nipple, none of which she has. Cancer has to be my first diagnostic guess, but let's see if I can narrow it down. So question for you smart people, what percentage of people will get cancer in their lifetime? Answers down below and I'll give it to you at the end of the video.
Spiders not the only interesting thing I found.
You have asthma?
Started acting up again when I moved into my new place.
Spider bite doesn't explain anything unless the patient was actually bitten by a spider. I'll do the exam.
It'd be better if a woman gropes her. There's no sexual tension that way.
I think I would have felt a spider biting me.
I really had no intention of ever seeing you again. I'm just really not that into repeat performances.
A little more practice for the both of us. I'd say we're looking at a 9. You didn't have to move your hand.
My hand's on your hip. You don't feel that? Means it's not a spider bite. Blood test confirms low potassium levels, explains the numbness in her hip.
What caused the kidney problem? CT her kidneys. If you find calcifications, we have her diagnosis.
Alright, break it up, nothing to see here. Call me Dr. Killjoy, but sexual tension has no place in a doctor-patient interaction, which is why doctors aren't allowed to treat patients they're romantically involved with or are family. Of course, if you're in the middle of the Sahara and you've got an antidote while your partner is gasping for air, then you're not exactly supposed to wait for the London ambulance service, because even in London, you may be waiting a while. Even though this interaction wouldn't have happened in real life, hopefully, it makes for interesting television and generated some more clues, numbness, and low potassium. 13 suggested this could be related to a condition called renal tubular acidosis, which is when the kidneys can't remove as much acid from the blood as they should. That causes the blood acid level to rise and lead to high calcium and low potassium. Since the kidney isn't secreting the acid into the urinary filtrate, which is hydrogen ions or H+, then it has to secrete potassium to maintain the electroneutrality of the urinary filtrate, which drops the level in the blood. The theory does make sense, but there was a clue just now that 13's asthma got worse when she moved into her new apartment, which could explain why the patient got worse as well. Since the apartment visit was a one-time appearance for the new patient, it was likely an allergy rather than an infection. There is a condition called hypersensitivity nephropathy where allergy can cause injury to the kidneys, which in theory could cause all her symptoms. The trigger could be mold spores, which are present in 13's place, which also explains why her asthma got worse. That has to be my first diagnostic guess.
That does not look like a pizza delivery.
Wilson doesn't buy his pizza.
Well, apparently, he has developed a taste for pizza.
CT shows one more calcification near the superior pyramid on the left kidney.
That, thing you were hoping House didn't find at your place. I found it. You did the CAC test 2 weeks ago. Number this high means you have less time than you thought. You're doing drugs, staying up all night, having sex with strangers.
Sounds fun to me.
There are 2 sets are dropping.
Well, she's not breathing. We need to intubate. It's not her lungs. No masses, no infiltrates.
Her lungs are working, but she still can't breathe.
Just maybe the problem's in the supply line, airway collapse.
Make it happen again. Methacholine challenge.
Exam going on, 15 minutes.
Morning, Dr. Headley. She has a fresh nightclub stamp on her wrist. She's in no condition to practice. I want her to take a drug test.
Because she went to a nightclub in her free time? Or because she had sex in her free time? I don't need you making my employees punch a clock or pee in a cup. Let's go. Patient stopped breathing, and you missed the differential. You're fired. I'm already taking responsibility for one doctor with a drug habit. A slutty party girl is fun until she pukes on your shoes.
You'd think House would be more empathetic to drug takers considering his situation, but at least he's doing it for pain and not to become the Charlie Sheen of medicine. Do IV drips even work for hangovers though? It's one of these untested principles that some people report having benefits from, but people also report having benefits from sugar pills and sham procedures where they've been put under anesthetic and nothing has been done to them. The placebo effect does do pretty good work at relieving symptoms that are modulated by our brains rather than the disease process itself. Part of why this hasn't been researched though is that hangovers are temporary and complications from IV treatments can be very permanent. Look at the case of Jennifer Cleveland, who in October 2023 went to a medical spa to have a vitamin infusion. That's where you get a solution containing nutrients without having to eat. After the patient finished, she got up and immediately fell down with her heart stopping. They tried to resuscitate the mother of 4, but unfortunately she died. It turns out that the authority to make the prescription for this IV medicine was under Dr. Gallagher, who was not even present on site at the time, and so the infusion was set up and given by someone with 0 medical qualifications or experience. The doctor was initially suspended, although that was overturned afterwards, and regardless of that, there are still hundreds of these clinics operating in a very similar way. Some of the infusions they provide, like glutathione, haven't even been approved by the FDA as an IV medicine, and they've even issued warnings against it. The claims for these hydration infusions include everything from fighting a cold or a flu and improving athletic performance to being a hangover cure without any solid evidence to back that. It blows my mind that they can still operate. None of this answers why our patient has stopped breathing without a sign of lung issues though, so what could cause that? The most likely would be a neurological cause, which is stopping the movements of the chest itself to initiate the breathing mechanisms rather than the lungs being damaged. For this to suddenly happen, then a stroke could explain it, but a spicier House-esque cause could be hypokalemic periodic paralysis. That's when low potassium caused by an ion channel mutation can cause paralysis, which spontaneously resolves after a few hours. Episodes can be triggered by strenuous physical activity, and so 13's number games may have something to do with it. It would fit really well and is treatable with meds that stop potassium dropping low in the blood, so has to be my second diagnostic guess. Question for you smart people: how many bananas does the average adult have to eat to exceed the recommended daily amount? Answers down below and I'll give it to you at the end of the video.
Did you meet someone?
I sort of started dating someone. She's a prostitute. Used to be. She wants to go to law school. And I told her I'd help her with tuition. You go to prostitutes. You can't be judgmental. Debbie makes me happy.
Did you talk about whether this lung field looks a little dark?
It's probably just overexposed.
Or her diaphragm's a little flat?
Lung cysts. Treadmill test isn't gonna close her airway. It'll make her lungs explode. You ruptured a cyst! Her lung collapsed. Trachea's deviating to the left.
Chest CT confirmed multiple lung cysts, one of which burst during the treadmill test.
You fired me because I screwed up. I just proved I can pull my weight.
How much clearer do I need to make this? Find client number 9. It's gonna be something I can use to force her to back off.
Here's the result from the lung biopsy.
It's the control that gets you off. And controlling women is as close as you can get to controlling what's gonna happen to you.
Here I thought I was just into boobs.
Tell the girl that she's got 10 years to live. She has land.
Oh, House fires 13, decides he's going to ignore her pleas for mercy, and then expects she's going to tell the patient she has a terminal diagnosis. And it'll probably work because nothing bonds people together more than shared hardship. While there is some girl-only action on screen though, it's no accident that the writers chose a condition that almost exclusively affects females. It's a genetic condition that causes smooth muscle to grow uncontrollably, usually causing symptoms between 20 and 40 years old. LAM can cause wheezing, shortness of breath, chest pain, and even coughing up blood. Generally, 90% of patients are alive at 10 years after diagnosis, and just 64% at 20 years before looking at a lung transplant. Very interesting and rare condition that only affects around 1 in 140,000 people, and it's a bit late to use it for my diagnostic guess, considering the biopsy result is already here. Who knows though, House has been known to throw a curveball or two before, and it is related to another multiple tumor syndrome called tuberous sclerosis. So let's get more clues.
I know what it's like to get this news, and no one should have to get it from you. The biopsy of your lung cyst showed smooth muscle cells. That's indicative of a disease called LAM. Little by little, the cysts replace healthy lung tissue until your lungs stop working.
I'm gonna die.
Yes, I'm so sorry. They removed all the cysts they could. That should help you breathe better.
Oh God, what's going on?
All her blood counts are down. It's a new symptom, aplastic anemia.
Aplastic anemia takes LAM off the table.
I'm glad you're here.
She needs a bone marrow transplant.
Jumping to a transplant when we don't know what she...
I know she has a blood disorder.
The new marrow would attack the old marrow. She'll die from graft versus host.
You got a better idea? Don't get her consent.
This was in his trash. He's using.
Genius.
Damn. You completely buy that I fell in love with a prostitute?
So, seriously, where were you the other morning?
Be outside my apartment at 8 o'clock tonight.
She said yes to the transplant.
You're gonna keep spiraling until you're dead. But until then, I can use you.
You're trying to save me, trying to control me. You're doing exactly what you think that I...
Cracks. Your lips are cracked. Did she cry?
No.
Whoa, 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 no tears, cracked lips, that sounds like an epiphany moment to me. You know what causes both, i.e. a lack of secretions in the mouth and eyes? Exactly what happens in Sjogren's syndrome. It's an autoimmune condition that attacks the lacrimal glands of the eyes and the salivary glands of the mouth to cause severe dryness. It can also affect other organs in the body and lead to lung cysts, kidney disease and hypercoagulability, which could lead to eye clots. It isn't classic though that it could cause aplastic anemia, but there have been some reports in the past. It's also more common in females by 14-1 and is very treatable with immunosuppressants like steroids. That has to be my final diagnostic guess, so we are locked in. It'll be insane if that's the right answer. Also love how Wilson has been onto House from the beginning, but have no idea what this 8 p.m. meetup will show. Let's find out.
An onion releases a mist of synpropanethyl S-oxide.
She has no tears.
She has Sjogren's. Lack of spit makes her mouth a breeding ground for a fungus like Candida. Your asthma inhaler did the same for you. Another life saved by girl-on-girl action.
You're gonna be okay. I feel alone.
You guys shop here too?
I'm adopting a baby.
She asked me to be a character reference. That's where I was the other morning.
But you're not listening.
It was Sjogren's, finally! I got one right, but now all of a sudden 13 has lost her reason for being connected to her on, off, on again, off again, love of her life moment, and has re-entered House's predicted spiral of demise. Fun fact about cutting onions: if you chill them before cutting or light a match, then they won't make you cry as much. One thing that isn't quite right here is that 13's inhaler that supposedly suppressed her mouth's immune system to get the same opportunistic candidal infection as the patient was a blue inhaler that doesn't act on the immune system as it doesn't have any steroid, which is what suppresses it. It's usually the brown inhalers that does that, which is why you should technically gargle your mouth after having it to get rid of any excess that's sitting on your big taster. I also have to admit, I knew Cuddy wants to adopt, as I have seen the next episode already, but it's interesting finding out how it happens. Really a good episode with interesting themes. 8.1 out of 10 entertainment, 6.8 out of 10 accuracy, and 8.5 out of 10 diagnosis, because knowing the Sjogren's and lung cyst association is insanely nice. They really did their research for that one. An adult needs 7.5 bananas a day to exceed the recommended amount, and 50% of people will develop some form of cancer in their lifetime. This episode doesn't make full sense until you watch the previous one where a patient tries to find her long lost parents. Here